So there's a growing understanding that there's an association between psoriatic arthritis and metabolic syndrome. So metabolic syndrome is essentially a cluster of risk factors that, when present together, put people at higher risk for developing diabetes and also cardiovascular disease. So if you have 3 out of 5 of these variables, you can be diagnosed with metabolic syndrome. So what are these 5 variables? They include if you have a elevated waist circumference or central adiposity, if you have a lot more weight around your stomach and waist. Number 2, if you have elevated triglycerides, meaning the fatty content of your blood is higher. If you have lower HDL, that's the good cholesterol that protects you. If you have higher blood pressure, and if you have elevated fasting blood glucose. If you have 3 out of 5 of these variables, you have what is called metabolic syndrome, and it means you are at much higher risk for developing diabetes and also much higher risk for developing cardiovascular disease. So, a study came out in the Journal of Clinical Rheumatology recently that wanted to look at this in a little bit more depth, because we're hearing more and more studies talking about how psoriasis and psoriatic arthritis can put people at higher risk for metabolic syndrome and also cardiovascular disease. So in this study, they wanted to examine that in a little bit more detail. This is a meta-analysis, meaning they looked at multiple different studies and kind of grouped the results together to reach some conclusions. So first they looked at what about psoriatic arthritis and compare that to the general population. And they found that, yep, psoriatic arthritis folks have higher rates of metabolic syndrome than the general population. On its own, that's interesting. Number 2, they then wanted to compare this to, well, what about psoriatic arthritis and some other autoimmune conditions? So first they looked at, well, how does this compare to just having psoriasis? Psoriatic arthritis versus psoriasis. And they found that there's a relative similar risk of developing metabolic syndrome in both entities. It makes sense. These are very related conditions. 20% of people with psoriasis also develop psoriatic arthritis. They then looked at, well, how about if you compare it to rheumatoid arthritis and ankylosing spondylitis? So psoriatic arthritis compared to rheumatoid arthritis, psoriatic arthritis has a higher chance of developing metabolic syndrome. And then they compared it to psoriatic arthritis and ankylosing spondylitis, and again, they found that psoriatic arthritis has a higher rate of developing metabolic syndrome. So overall, we're starting to come to this conclusion that psoriasis, psoriatic arthritis, folks are at higher risk for metabolic syndrome and thus also cardiovascular disease. And it's the reason why I think an essential aspect of managing psoriatic arthritis and also psoriasis is to work on lifestyle factors such as diet, nutrition, and exercise. So critical. Medically, I think we have great treatment options for controlling the inflammation aspect. We've done really a great job of, I think, honing in on algorithms and treatments for that aspect of the condition. I think we need to progressively put more and more attention on the metabolic consequences for these conditions as well, because there is such a significant connection with metabolic syndrome and psoriatic arthritis, and thus also cardiovascular disease as well. And that means really formally focusing more and more on nutrition and exercise, utilizing the other kind of tools that are out there, such as the GLP-1 agonists, to maximize what we can do for our patients metabolically and weight loss wise as well, and to really comprehensively manage our patients who have psoriatic arthritis more aggressively and more completely.